Hi guys, welcome back. Dr. Haider Ali, pulmonologist, and nice to see you again. So we're going to talk about something a little bit different today. Do you or one of your loved ones constantly live with cough, mucus production, recurrent infections, all the things that we would say are hallmarks of a condition called bronchiectasis? If so, then this video is for you, so watch closely. So today we're going to be talking about a brand new drug that is hot off the press. This drug is called Brinsupri, or brensocatib as the actual drug is called. And this is a drug that was just approved this month for a condition called bronchiectasis. Now, what's really interesting about this drug is that this is the first time we have ever had a drug that's specifically made for bronchiectasis. So within the pulmonary medicine space and bronchiectasis specialists like myself, this is a very, very exciting moment. So we're going to take you through a little bit about the disease, a little bit about how the drug works, and why this may be a really good option for you or your loved ones. So watch closely. So as I was saying, Brinsupri is a brand new drug just approved by the FDA. We've known this has been coming for a little while, and there has been building excitement about this because this is the first drug, like I said, that we've ever had for people with bronchiectasis. So first of all, let's just take a very quick recap about bronchiectasis and what exactly it is, right? So it's a chronic condition that people can get. It's debilitating. Imagine your lungs is like a tree, the branches of a tree, and all those little dividing branches are your little airways. Now, what can happen in bronchiectasis is your airways can just get very, very inflamed, either caused by an infection or from some other cause. And as they become inflamed, they create more mucus, and that mucus can get stuck down there. And bacteria love to get in where mucus is. It gets in there, it multiplies, it makes itself a really nice home. And if that mucus is not expelled, it creates more inflammation, and your body thinks it's under attack, so it sends more white blood cells to try and kill the infection. And what happens is this constant sort of vicious cycle of infection, and your body's response to infection leads to a lot of damage and scarring in the airways. And so it can be a very severe disease, and the hallmark is really recurrent infections, daily productive cough with fairly thick or colored sputum on a daily basis. And people can lose weight, they can get more nasty infections, they can even cough up blood. So it's really not a pleasant disease to live with. So the fact that we have a new drug that could potentially treat this is really exciting. So how do we treat bronchiectasis? Like, we've covered this a little bit in prior videos, but really it's so important to get that mucus out of the lungs. Really, if we clear that mucus, we take away the home for the bacteria. So there's nowhere for the bacteria to sit around. So really good mucus removal from the lungs. We often use antibiotics as well to kill or suppress bacteria. But all this is really just treating the symptoms. We're not treating the underlying cause of what is causing this repeated, inflammatory cycle in the airways. And that's where Brinsupri comes in. So the way Brinsupri is different is it is actually treating the underlying cause of the disease. So it's breaking this constant inflammatory, vortex or vicious circle that's going on. So when you think of it as like a wildfire, your lungs are on fire and your body is sending neutrophils or white blood cells to try and fight this infection. And so when these neutrophils are like the sort of almost like the police force in your body, they come to the airways and they try and, round up all the bacteria and kill them. But what's happening is these neutrophils, although they have very good intentions, they can be a lot of collateral damage, a lot of scarring. They can cause a real mess down in your airways. And if they're always around, always creating, trying to clear these bacteria, it goes from being almost like a police force to like a riot team. Like they're always there. They're sort of, ready to jump on the bacteria, and it basically becomes a really sort of a big battlefield down there. So what Brinsupri does is it actually calms those neutrophils down, and it tells them they don't need to be on such high vigilance all the time. And by doing that, they can sort of just lead to less inflammation in your airways, and your airways will not get as kind of inflamed. There won't be as much mucus production. So even though the bacteria are there, if they're not causing an immediate problem, the neutrophils don't need to kind of really step up and just do their thing and cause even more damage. So it's kind of like, rather than killing the bacteria, we're sort of saying to your body, your human body, it's saying, you know what, we know the bacteria is there, but just take it easy, calm the cells down, and that can really help your airways out in the long term. So in a way, you could say Brinsupri is almost like a very novel anti-inflammatory medication. What it's doing is it's telling those neutrophils to stop releasing those very damaging enzymes, which in many cases are helpful in your body, but in this case, they're causing more damage than good. So if we can stop the neutrophils from being so charged up, we're going to save your lung function. And so the key takeaway here is that this is not a drug that's treating a flare-up. It's not helping you remove mucus from the lungs, but it's really treating the underlying cause, again, which is a very novel thing in bronchiectasis because we've never had something like this before. So let's talk a little bit about the clinical trials that were done for this drug, and I'll try and break it down in very, very simple terms. But there were two very large studies that were done which looked at people who were taking the drug, the Brinsupri, and people who weren't taking the drug. And they were taking a placebo, which is kind of like a sugar pill, which was made to look like the drug. And then they followed these large groups of patients forward to see what would happen to them. What would happen to their lung function, what would their symptoms be like, how many flare-ups would they get, things like that. And there were two very important things which came out of the study. The main one being that Brinsupri really did reduce the number of exacerbations people were getting, but it seemed to work the best in people who were really having a lot of exacerbations every year. And we would consider that, 2 or more exacerbations or flare-ups every year. So if that's something that you think you suffer with, definitely this is something you should speak to your doctor about. The other thing that we found with Brinsupri was that it may actually help preserve your lung function over a longer period of time. And so that's another interesting part to it, because the name of the game, as I've said in previous videos, is really preserving your lung function. So anything which can help prevent you from ending up on oxygen or being much more breathless later in life is really, really important. So the fact that this drug could actually help the future you in 10, 20, 30 years from now is massive. And we need to keep watching for these results to see if it still plays out over time. So what do fewer flare-ups mean for you? Well, it means fewer doctor's visits, hopefully, fewer urgent care visits, fewer ER visits, fewer hospitalizations if that applies to you, but also fewer rounds of antibiotics. We know every time you get antibiotics, there's always a risk, right, that you can get side effects from antibiotics. You can get diarrhea, you can get feeling nauseous, they don't make you feel great. They can change your gut flora, your bacterial flora, so it can kill good bacteria. So we really want to minimize how many courses of antibiotics you're getting. So that's a really good part of it. All that being said, that would mean fewer bad days, more good days where you can do stuff with friends and family, more days where you're not so fatigued you can't leave the house, more days where your appetite is good, your mood is good. So there's a lot of benefits from this. So I think it's something we should definitely pay attention to. Okay, with any drug, we always have to talk about side effects. No drug is completely free of side effects. So what side effects were common with Brinsupri? The most common one was pretty simple stuff, like headache. Maybe some people felt a bit nauseous, maybe sore throat. The main sort of serious ones that were very, very infrequent were things like a rash, and some people could get issues with their teeth and gums, like gingivitis or an inflammation of the gums. Again, this was very, very rare. But it's something that you should, be mindful of. If you do start this drug, it's really important that you follow with a dentist regularly and get twice yearly checkups and make sure he or she knows that you're on this new drug as well. So those are really important things to be aware of. So who can take this drug? Well, the FDA cleared it for anyone who's 12 years and older with a diagnosis of non-CF bronchiectasis. So sorry guys, if you have cystic fibrosis, this drug isn't for you, but you probably have a lot of very good options yourselves. But this is for people who have bronchiectasis but do not have cystic fibrosis. So anyone from 12 years up to 99 years old, you could basically take this. So just to wrap this up, guys, if you have bronchiectasis, or you think you may have bronchiectasis, or you're someone who suffers from a chronic productive cough, um, definitely have that conversation with your doctor. Ask, is Brinsupri, could this be something I can take? Am I eligible for it? It's certainly not for everyone. I think it depends on your individual circumstances and what drugs and health issues you have. But also just emphasize, this does not replace any of the other treatments that are really important in bronchiectasis, such as doing airway clearance, such as antibiotics if you really need them, and other sort of inhaled drugs that will help you remove mucus from the lungs. So it's definitely a very important adjunct, but it doesn't replace many of the things you may already be doing. So guys, just to conclude there, this new drug really marks a new era for bronchiectasis, because it's the first time, I think it's opening a pipeline potentially of new really good drugs for bronchiectasis, and it's going to empower you guys, the people who have symptoms, to have more hope and hopefully live in an era where your symptoms don't cause such an impact on your day-to-day life. So I'm really excited. I hope many of you will get benefit from this, but definitely have that conversation with your pulmonologist, and we're all going to learn about this new drug together. But I think it's a great start, and I hope you benefit from it. So stay well, and thanks for watching, guys, and I'll see you next time.